A warm welcome to all our viewers, to our series Natural Medicine Today. I am really happy today that I have a wonderful doctor with me, Alexandra Kotthaus. She is chief physician at the Sonnenberg Clinic in Switzerland. And I am very pleased that today we are talking about breasts, including diagnoses and examination procedures, and examine it critically. We're going to get into that topic together. Stay tuned. Hello, dear Alexandra, thank you for coming.
Thank you, Corina.
I think it's so nice that you have such a nice, broad spectrum. You also have a specialist in psychotherapy and psychiatry, and then general medicine, and also the anthroposophical and naturopathic aspect with it. And all the nicer that we are going to talk about the subject of breast tissue today, because women, in the line of conventional medicine, are very hard to be diagnosed, and it can just be taken out and squeezed and x-rayed and it doesn't matter. It kind of seems like there isn't really a holistic aspect behind the whole action, is there? What do you think about that?
Macht irgendwie den Anschein, als ob da nicht wirklich ein ganzheitlicher Aspekt hinter der ganzen Aktion steckt, oder? Wie siehst du das?
You said that very nicely. No, that's right. So for one thing, it's just being brushed off as more and more normal. Many women over 40 have a mastopathy. Masto means breast and pathy means disease. Many women feel this when their breasts are perhaps a little fuller. It used to be totally unusual that the breasts become fuller with age. When I was a child, my aunts, mother and the like were more concerned that if I breastfeed, or if I get older, then I'll get sagging breasts. You hardly see that today. Most women, both young and old, and postmenopausal, tend to be very busty. And that's actually not normal at all, and in this busty bosom or breasts, bosom is actually the space in between and breasts are all around. But people tend to confuse these terms. It is not uncommon for there to be a mastopathy, so a change in the breast tissue. Sometimes women feel that cycle-dependent also as pulling, tightening up to pain in the breasts. The tissue is partially condensed. Many women have cysts in their breasts. It is of course in some way a form of inflammation, then it can lead to calcium deposits. Calcium deposits can in turn cause problems when you do this mammography, that is, that X-ray examination, that squeezing, what you just said. So during the X-ray examination the chest is squeezed between two plates, as close as possible to the chest, because you want to depict the breast up to here. And so that you can see as much as possible on the X-ray image, the breast must be pressed as flat as possible. Let's say the breast is already sensitive anyway, because actually mastopathy can definitely be painful. I think there is something degrading or humiliating about the whole examination. Many women feel that way. And then it's just like that. When I'm doing a mammography, we talk about the radiation exposure. I'm not talking about the same thing as doing a chest X-ray. A chest X-ray is simply the picture of the lungs. I'm exposed to radiation, which when I'm out in the open, I can accumulate in 3 days. What I have in this fraction of a second with the mammography, that is already a radiation exposure. It will take me at least a year, if not more, if I'm right. This means that I have a different radiation intensity, so that I can even get to soft tissue with X-rays, because actually I use it for bones mostly, or things that are close together like where the heart is. It shows up on the X-ray of the lungs, of course, but I can use it to analyze bones and not soft tissue. That's why I have to change the radiation intensity and quality. So I have a completely different radiant energy acting on the chest. This in turn means that the cells can mutate. I can produce breast cancer through mammography. That's why it's usually only done after 50 years of age, because then, statistically, I don't want to lie, women usually die at 82 years of age. So at the time when the breast cancer would be induced by the mammography, because I have a latency up to 30 years after certain X-ray examinations that the cancer rises.
And now the question arises for me too. Again and again I have women who come after a mammogram and say they have inflammation and pain afterwards. And what was triggered now?
I don't want to say that something that's so acute can be triggered by radiation. I can't rule that out now, but I can't answer that 100%. But if I previously had breasts that had undergone mastopathic changes, which means there was already a bit of inflammation in there, and I'm squeezing it really hard now. Everyone can imagine, if I pinch your thigh hard now, you might get a bruise. A few cells broke there. If cells break, I have a release of perhaps inflammatory substances, or the tissue has to heal again, get organized. I have an immigration of cells that help with this. Of course, I can make such a latent situation acute.
What alternative imaging procedures would you have to analyze the breast, which causes far fewer problems?
On the one hand, there is a breast ultrasound. Here you have to see that the breast ultrasound also depends on how good the person doing the ultrasound is. But it has to be said that it is not much different when evaluating the X-ray. There are also many misdiagnoses there, which is why now, when you look at the overall picture, how much sense does mammography make? Also because it leads to misdiagnosis. This leads to fear and panic-mongering, to operations, and if you now count the women who have side effects from the operations and there too, death can sometimes occur, because an operation can trigger a thrombosis, for example, pulmonary embolism, or it can trigger and aggravate things with other things. If you look at this total, then I won't save a life with the mammography. It may be that in individual cases one woman dies less from breast cancer. But in terms of deaths, I'm not saving lives. She then dies of something else, something that happens as a result of this procedure. And now I've strayed a bit from your question.
I wanted to know, with the ultrasound, whether that would be a possibility. And then of course there is also the issue where people really touch professionally. Above all, there is a certain group of blind people who are really experts. They are much better in this technique.
Perhaps one more sentence to the ultrasound. The one who does it should be practiced. I would almost recommend for a layman to go to a professional breast center. However, sometimes they only want to do the ultrasound after a mammogram has taken place. This is puzzling to me. So I have to say, women, speak out loud. Don't let them treat you like that. A small limitation is in the case of very large breasts or, depending on what you might see on the ultrasound, how changed the breast tissue, is that then maybe no precise diagnosis can be made. But then I would still opt for an MRI rather than a mammography.
And what does an MRI do?
That's the magnetic resonance technique, the so-called tube, where, depending on the examination, you can also get a contrast medium. In the organic scene, patients say, "Oh, I don't want that." But if it's really about getting clarity, and there may already be a suspicion from the ultrasound, then I would say that it is important that you really know what it is about. I would then accept that. Then you are right. There are more possible examinations. I just have to say, I know that it exists. Unfortunately, we don't have the opportunity to work together with people, or even dogs, who can now do this. But it is explored and with promising results. What still exists is the so-called thermography, which is actually considered to be well researched, where via heat radiation, an infrared measurement of the skin, is it examined to see if there is an interference field. But now you have to say that it doesn't give a clear indication whether it's breast cancer or not. But the method is so sensitive that one can say up to years in advance there is an interference field and something could develop out of it.
Super exciting too, of course, because then I can of course react, because you say often also with breast cancer, there is usually a root canal treatment on the same side or dead tooth or there is any heavy metal contamination, that you then say preventively, I'll do it now as a precaution, just deal with detoxification more.
Ja, einfach mehr mit Entgiftung mich auseinandersetzen. Hei, 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 bam, bam, bam. Vor lauter Gestolper. Ja.
And now the big question about this puncture. If there is something.
Punktion. Wenn dann was ist. Und
it was always like that, including in my studies, the theory that you shouldn't pierce a closed tumor and also, either you take it out or you leave it alone. But you don't drill around in there and scatter it somehow. What do you think about that?
I know both sides. There are people who heal anyway or who still have, even if it's malignant, when that is the result, still have the option of full remission. It's not like you can say I'm going to mess something up, at least not necessarily. It may reduce the odds at times. I think that is primarily a case-by-case decision as to whether you can remove it completely. There are such criteria where already by the imaging you can tell that it is malignant or not. But that's so individual again, a tumor that might grow like a datura or something. Well, you would think it's rather malicious. But it could also be more difficult to operate on. You can't say that I can completely remove every tumor right away. Now, if we say we're talking about a little thing that somehow looks well defined in the imaging, then, if I was infected, I'd say, come on, we're not going to do a biopsy. Just take that thing out completely. If it was benign, it was nice, and if it was malignant, I'm happy too. Although that's not so easy now. If a tumor is malignant and I take it out, then I am perhaps tumor-free on a macroscopic level. So macroscopic is what I see with my eyes, what I see with imaging. But it may be that I still have the potential that the tumor continues to grow. So it's not that with every tumor that I operate out, there is automatically more security, longer life, or something like that. There are also patients who say, the doctor doesn't want to operate on the tumor at all. But you know that it doesn't help with the tumor. Apart from the fact that I might also put a strain on my body with the operation, I don't have any other or no particularly longer chance of survival. But now I weigh it up with the patient on a case-by-case basis, and of course, with all the findings that I have, or say, maybe we'll do the examination before, I say, do it one way or the other. As I said, because it's not just every tumor, snip, I'll operate on it. Depending on where, at what point it is, that would be sometimes easier, sometimes not easier. But in synopsis, with all the findings that you have, you need to weigh it up. Sometimes it's really about knowing what kind of tumor it really is. There are more hormone-dependent tumors and there are less hormone-dependent tumors. I now deliberately say less and not non-hormone-dependent tumors, because ultimately all cells have hormone receptors throughout our body, whether healthy or cancerous. So I can trigger any cancer with hormones, which is always hormone-dependent, even if it's not 3 times positive for an estrogen receptor or something. As you can see, this is actually a complex topic, and maybe one more sentence. But I've seen time and again in patients who have had surgery, not only now on the breast that there can be small settlements, so metastases, on the scar where one then already thinks it can actually only have come about through the operation.
Then of course there is also this issue, taking everything out, then the problem is already solved straight away. We also had a few role models in Hollywood who then simply emptied their chests. That's the end of the issue. But in conventional medicine, I would say that also has become so common. Also this misogynist, to operate everything out, already with the uterus, and we just take everything out. That's not the case with men. Let's take the testicles out, don't give a damn. And what do you think of such an extreme, preventive measure?
That's hypocritical. This is sham prevention. It's not prevention. Breast cancer is still not inherited, but a predisposition. Most of the genes that are said to have an impact on the tumor development or tumor aggressiveness are often genes, for example, detoxification enzymes, detoxification channels in cell membranes, also known in Alzheimer's. The APO4 allele is a channel protein in the cell membrane. People are worse at detoxification than other people, repair genes. Influence that they work worse. That is, with a healthy lifestyle, with detoxification, I can do an incredible amount. That's the one point. Although with some people, or if this mutation is really there now, they must really detoxify well. Not like, oh yeah, I once did a detox cure that was 4 to 6 weeks. I have to say, dear people, that's naive. So a proper basic detox looks different. And if I am handicapped in this sense, or sometimes we test detoxification enzymes, I have to be more or less serious about it for life, with a healthy lifestyle. Where I have to say, okay, sometimes the grass on the other side looks a little greener. How come they can live like that and I can't? But be aware the others will also get the reaction.
Again, on the topic of proper detoxification, I think we will do an extra interview with you because it's a very complex subject.
It definitely is. But now to the breast operation. Taking it off is the one part. I can do prophylaxis. And the other part is why I just said it's basically hypocritical. They do not reduce their risk of cancer, and can still develop cancer, even if the mammary gland tissue has been removed. They don't have a better outcome with their life just because the breasts are removed. But even before I slipped or went into all this biomedicine, I learned this during my school medical training.
You also generate further interference fields through the operation. So there are other factors involved.
There are other factors as well.
If you really have someone there who has been diagnosed with breast cancer, I've always noticed it in the past with friends. Here and there they always get the gun pointed straight to the chest and are immediately catapulted into such a spiral of fear, so you can't think straight at all. They are then caught in such a state of shock. What would you advise women who are now coming from mammography and then someone comes and says, oh, that doesn't look good at all? Then a house of cards collapses for many. What is the most important thing for you to consider when it comes to things like this? What are the first steps? Can you maybe say, hey, relax. The thing has been in there for many weeks, probably months. 7 days to come around, reflect, won't make such a big difference. Or how would you deal with it?
No, 7 days certainly won't make a difference. But I think it's important that you really look and take the next steps. If there is a suspicion that one also finds out, is that now malicious, or isn't it malicious? You have to discuss this with your doctor in individual cases, or sometimes with an alternative doctor, or something like that, or get a second opinion, often for the person concerned. I've experienced that too, that the patients then react to it. There is the suspicion, and should it get out immediately? And sometimes there are still options for intermediate steps, that you say, well, after the mammography you do another ultrasound. Of course you can also look at blood values, or you can do an MRI, and that also gives clues. But to be honest, you have to say that these are clues, and what I examine in the blood are also clues. So a completely normal blood with typical values that can change in tumors, such as anemia, LDH value, tumor markers. It can be completely unobtrusive, and I still have a nasty, aggressive thing inside me. But if they are not inconspicuous, the values, well, then it is even more urgent to clarify further. It may be that afterwards the only possibility remaining is biopsy or surgery to be really sure. I'm actually in favor of providing certainty, because otherwise it is really a latent drilling internally. Is it now or not? Do I have the sword of Damocles above me or not? And on the other hand, it is of course also important, also for us, as if we are now practicing holistic medicine. If this is breast cancer, I treat it more intense than if it is a benign tumor or a mastopathy. I have more time. It's very clear, then I can look at it in peace, this way, that way. Has it become less? Can I see from the blood values that the toxins are out, things like that. But in the case of cancer, of course, we also have a different treatment procedure.
When it comes to nutrition, is there something where you say, also in relation to watching out for the hormones and the whole thing, that it doesn't push so much? There used to be the topic with the soy or dairy products, which contain certain estrogens again. Is there another little tip?
Eben auch Milchprodukte, die gewisse Östrogene nochmal, gibt's da noch so einen kleinen Tipp, was da?
It's true that Asian women, until they adopted the Western diet, had almost no breast cancer. And these are numbers which now go back to 3, 4, 5, 6 decades. At the time, this was attributed to the fact that they consumed virtually no dairy products and also eat soy. But now we have certain problems with the soy. Although there are phytoestrogens in it, all the conventional medicine doctors say, and flaxseed and the lignans, and just no plants where there are phytoestrogens, you definitely can't eat that. But there are now people who have researched this and who say flaxseed is good for breast cancer. So quite the opposite. In fact, we have different types of estrogen receptors, not just one. And you can roughly say that the good estrogens, including the phytoestrogens, so to speak, dock onto, I'm going to make it very bold, the good estrogen receptor. And the bad estrogens, the xenoestrogens, such as glyphosate, DDT, BPA, they dock onto the bad, that roughly speaking has more growth power. And sure, in dairy products, baby food, I have growth hormones anyway. The body also releases growth hormone when you eat casein. And if it's not proper animal husbandry, and species appropriate, is not even the organic one necessarily, because cows don't eat grain either, they eat grass outside in the meadow. Then I also have growth hormones in it, but now I think, is it at all ever been thought that way? So whoever formed that body many, many years ago, that we are consuming infant formula from a different species. Via animal products, they are already advanced in the food chain. Since then, due to our environmental pollution, more toxins have already accumulated in there. Of course you can do a lot, but there really are these phytoestrogens. They probably aren't as harmful, or aren't as harmful as it has been said. However, with soy, how can I get non-genetically modified soy? If I eat genetically modified soy, I nullify the good effect.
It's a complex topic all around. All right. Have I forgotten something important now? There was one question that was on the tip of my tongue the whole time and I can't think of it now.
Sendung mit
Well,
gemeint.
maybe I'll think of it in the next interview with you, then I'll ask it. Do you still have important points to address, or if a woman really wants a second opinion?
I think if someone wants to see for themselves, then I would recommend the book by. I always swap the first names. I think his name is Gerd Reuter, The Betrayed Patient. That says it all nicely listed with the mammography. How useful it really is. How the outcome of the mammography is. Also colonoscopies and things like that are listed. I think did his homework quite well. Also for, I think. I read it as a medic, but I think it can also be read by the layperson, and as a responsible patient I think it is worth reading. And we women are more than welcome to go on the barricades, as before, how we are treated and more responsible for our health. You can make another program on that. Drug trials on women, they get the same doses as men, even with blood pressure medication, or something like that. Psychotropic drugs. All things that are actually wrong.
Yes, exciting topic. But it brings us more and more into personal responsibility at the end of the day.
Women are quite good at that. They are on the right track there.
Thank you very much, dear Alexandra, for being here today and for the beautiful all-round view. I hope we could help some women with that. Thanks. Dear viewers, it's wonderful that we always have guests, which offer us a holistic view of our body and our health. I hope you were able to take something with you. Thank you very much for watching. I wish you a wonderful time and see you soon. Bye.